So I welcome everyone in today's RB Talk Show, and today we have a guest speaker, Dr. Poorva Chaudhari. She is from Mumbai, and a small brief about her. She is a lab director and consultant pathologist at Swanand Pathology Laboratory, Dombivli. She is MBBS MD in pathology from Sion Hospital, Mumbai, and also has experience of working in Tata Memorial Hospital. Her special interests are hematology, cytology, and histopathology. Swanand Pathology Laboratory, she started recently. It's a ISO certified and NABL approved laboratory. And just 1 year of establishment, it is one of the fastest growing lab in Dombivli. So today she's going to share some knowledge, experience, awareness about the lab test and on diabetic test. So welcome to Dr. Poorva again, and over to you. Please do whatever it's time is yours. Thank you.
Thank you, Mr. Rohit Badia, for inviting me to this webinar, which is actually the need of the hour. And thank you everyone for taking out time and joining the session. And I hope that you all benefit from this session, and I'm successful in clearing your doubts about pathology test. So I'll start sharing my screen with
please.
you all.
Yeah.
So as Mr. Rohit Badia has very correctly told about the introduction of mine. So I'm Dr. Poorva Chaudhari. I am done my MBBS and MD in pathology. And now I am lab director and consultant pathologist at Swanand Pathology Laboratory, which is in Dombivli East. So this is our main processing center, which is near Nehru Maidan, and we have more 3 collection centers across the city. We have the fully automated and interfaced instruments. What I mean by interfaced is there is no manual typing in such labs. Okay, so whatever samples we run in the lab, the values are directly interfaced from the instrument to the software which we use in the labs, and therefore because there is no manual typing involved in the process, so the accuracy is increased. Right. So this is what we any good NABL lab actually does, this interfacing of instruments, and any good lab is fully automated, and just like that we too operate. So we have achieved this NABL accreditation in just 1 year of establishment. So that was one landmark that we achieved. So today we will be talking about the general awareness about the pathology testing. Right, so this is, I think, very much this area is not neglected in many times. People don't know. They just doctor that they tell you some test to do, and then you go to the lab, you do the test. But then there are many instructions that have to be followed before you start testing. If you don't know the instructions properly, then your accurate results are not taken out from any lab. So that's why we do the testing. That is our primary thing. But more than testing, what we do is spreading awareness on the testing instructions. We want that our patients, they know the testing instructions, they know what they have to do before any routine test, so that they prepare themselves adequately for the testing and they get accurate results, right? So in that regard, we have a lab testing guide also, which is published by me, and you can get it at all our centers to have the info in detail. So today we will discuss some aspects of it. So if why it is very important, because if your sample collection method is wrong, then you will always get wrong results in spite of a good lab. Okay, so even if you go to any big lab, any NABL lab, and you don't know what are the instructions to be followed, the pre-analytical testing instructions that we talk about, then you will get wrong results in spite of a very good lab. So this is the most neglected but very important step in pathology testing. So we will highlight this today. So you have to first get ready with your instructions, get set with them, and only then you should test yourself. So let's see what are the instructions. Few important points to note. I'll start with extremely basic things today. So first of all, we all have heard about fasting, right? So हमें डॉक्टर बोलते हैं कि अभी ये टेस्ट करना है, आपको डायबिटीज की जांच करनी है, तो आपको फास्टिंग आना पड़ेगा, राइट? फास्टिंग में हम क्या करते हैं कि दे टेल अस दैट आपको कुछ खाना पीना नहीं है. डायबिटीज का टेस्टिंग है तो 8 से 10 घंटे कुछ नहीं खाना है. कोलेस्ट्रॉल का टेस्टिंग है तो 12 घंटे कुछ नहीं खाना है. So what wrong thing people do in doing fasting is, some of them, they don't eat anything, but they drink everything. They have tea, coffee, everything. That's again a wrong method of fasting. Some people, they don't eat anything and they don't drink anything. They don't drink even water also. So even that is wrong. So how to do proper fasting? What is the most right way to do fasting? So fasting is, you don't have to eat anything, you don't have to drink anything, but you can drink water. So the most important point to note here is, fasting is not dehydration. Please, everybody will have to remember this thing, that you have to keep yourself very adequately hydrated before you go for testing, even if you are doing it in fasting. Okay, so water is allowed, पानी पीना अलाउड है. आपको जब भी चाहिए आप पानी पी सकते हैं, बस आप टी, कॉफी या कुछ ईटेबल्स नहीं खा सकते. That is how you do the fasting. So this is a basic rule to be followed for testing. Next is, many of times we don't know that why fasting is required in the blood test, right? ऐसे क्यों कहा जाता है कि कुछ टेस्ट को फास्टिंग लगता है, कुछ टेस्ट को फास्टिंग नहीं लगता है, right? So why it is required? Because all of the food and drink we consume, besides water, yeah, they have some sort of vitamins, minerals, fats, carbohydrates, proteins. They are going to affect the blood level of our readings, right? So that's why we are not going to consume any of this in our fasting period. Water में ऐसा कुछ भी नहीं होता है, इसलिए water चलता है. Okay, so that's the whole mechanism and whole idea of doing fasting for some test, right? So yes, so we will go to diabetes testing. What are the instructions of diabetes testing? You will see that these instructions are very, very basic instructions, but neglected ones. So we will have a glance of it today. So first of all, आप जिस दिन टेस्टिंग कर रहे हैं, उस दिन एक दिन पहले, उसके एक दिन पहले, you have to have your dinner at your regular time, right? उसमें कुछ change नहीं करना है, right? Approximately diabetes के लिए testing जो fasting लगता है वो 8 to 10 hours का लगता है. Okay, so 8 to 10 hours का fasting you have to do. You have to eat your dinner at regular time on the previous day. Whatever your medications are there, please take them as per your daily schedule. Because 99% of cases we have to assess that what our medications are doing on our health, whether they are working or whether they are not working. So we have to test with all our regular dose of medications. But yet, if you're taking any other tablets, please consult your doctor before doing the test one day prior. Okay, so yes, very important, 24 hours prior to testing, please avoid alcohol, avoid any sweets, avoid smoking. Okay, why? Because all these three things will speed up your digestion and you will get false results. Okay. Next is, जिस दिन आप सैंपल देने वाले हो उस दिन आप सुबह एक्सरसाइज मत कीजिए. Okay, avoid exercise during the fasting period. Okay, so for that day you do the fasting, give the sample, and then you can exercise. Okay, so avoid exercise and fasting. Next, we all know that we have to give the post lunch sample, right? Fasting एक बार देते हैं और lunch के 2 घंटे बाद हम sample देते हैं for diabetes testing. Now, what is the exact thing that you have to do here? Now, post lunch it is. Please mind, it is not post breakfast. Okay, what is the main thing that we do? We always give the fasting sample, we do the breakfast, and then after 2 hours after the breakfast, we go to give the post-lunch sample, which is completely wrong. Okay, what you have to do, you have to give your fasting sample, you have to do your breakfast. After breakfast, take your lunch at your regular timing. Exactly 2 hours from the start of your lunch. Okay, please mind this word, start of your lunch. Okay, so if I am starting my lunch at 1 p.m. right, so I have to notify my lab कि मेरा जो खाना है, खाना खाना मैंने 1 p.m. को start किया. So your ideal time of giving the post lunch sample is 3 p.m. Okay, so it is not the end of the lunch, it is the time of start of the lunch that has to be taken into consideration. Okay, so this is very important. Next, do not change your routine drastically on the day of testing. Okay, अगर आप कहीं शादी पे गए हो, आप कहीं बाहर गए हो, तो इस दौरान आप जो रेगुलर टेस्टिंग है, रूटीन टेस्टिंग है, वो मत कीजिए. जिस दिनों में आपका रूटीन हमेशा की तरह चल रहा है, only at those times you do with your routine testing. Emergency testing तो obviously you will have to do whenever doctor tells you, but then do not change your routine drastically. Okay, and of course, if you're going for a routine test and if you had a poor night's sleep, it is advisable that you reschedule your test. Okay, because poor night sleep can alter your levels majorly. Okay, so this is what we avoid in routine testing. Okay, emergency testing ke liye, these are not the rules that can be done at any time. Okay, so this is one of the features that we give for our diabetic patients from our lab. So this is basically a diabetes tracker diary, which will track the parameters related to the diabetes control. So just a glimpse of this diary I wanted to give. So this is a diary, the middle page of this diary, and whenever the patient is coming in the morning, then we note down the name of patient, age, sex, and history of the patient. We note down the date. For them, we have given the services of weight and BP as complimentary. We take this diary from them at the time of testing in the morning. When we give the reports, we give this diary filled to the patient. Here we note down the fasting blood sugar readings, the post-lunch blood sugar readings, the HbA1c readings if they are doing the HbA1c also. So HbA1c is basically, it is a monitoring, it's an average of the last 3 months glucose. Okay, HbA1c, serum creatinine, okay, if they are doing it. Now these 4 parameters, why I have included them is they are very important in seeing the progress of diabetes in patients. Okay, and these are our signs to authenticate the readings. So if you are a doctor and you yourself, you can get a glance of all your readings in this diary. Okay, so similar diary, you can maintain it at your place also, or if you want, you can take it from us also. So this is just a method, a very easy method to track your diabetes levels. So we all tell our patients that you are definitely stronger than diabetes. So diabetes can be controlled by regular testing, regular tracking of diabetes, and proper diet management. Yeah. So that was all about diabetes in very short. When you're doing a lipid profile in any lab, so lipid profile mein you will have all types of cholesterols to be tested, triglycerides. So mainly जो भी cholesterol से related सब test है वो lipid profile में आते हैं. इसके लिए we need 12 hours of fasting, which is absolutely compulsory. Okay, maximum allowed fasting period for lipid profile is 14 hours. Okay, other instructions about fasting, they remain same as that of diabetes testing. Okay, now some routine tests which require fasting. Now these are, I am talking about only routine tests. Okay, there are many tests available, and maybe that is not the scope of this lecture today, but we will talk only about routine tests which will require fasting. In that, we require fasting for diabetes testing is already done. Testing for lipids, that is cholesterol. Homocysteine testing, we need fasting. And free thyroid, free T3, T4, TSH will require fasting. Okay, and yeah, very important. Now this is an area of major confusion in many along with the clinicians and the pathologists and the patients कि thyroid का testing के लिए क्या instructions follow करनी है. Okay, so these inputs are from my books and from the input from good endocrinologists which are working in Kalyan Dombivli. So as we all know, thyroid function tests, they are of 2 types. Okay, so the first type is a total T3, T4, TSH. इसमें हम क्या करते हैं कि जो total T3, T4 के levels हैं blood में, उसको monitor करते हैं. Okay, so for this, if you're first of all, when your doctor is telling you कि you have to do thyroid, please ask your doctor whether I have to do a total T3, T4, TSH or I have to do free T3, T4, TSH. Okay, so these are the two types of TFTs, and you have to be very clear that which test you have to do. Okay, so if you're doing a total T3, T4, TSH, then it is to be done preferably in the morning before 11 a.m. For this, fasting is not compulsory. Okay, and you can take your regular thyroid medications along with that. Okay, this is for total. The next is the free T3, T4, TSH. Now for this, you have to do fasting, and you don't have to take your thyroid medications on the day of fasting before giving the sample. After you give the sample, you can take your thyroid medications. Why? Because whenever you take your thyroid tablet, and we are of course measuring the free level of hormones in your blood, the free T4 levels, they increase in 1 to 2 hours. And that's a false increase in the T4 levels. So we don't want to measure that, right? So that is why we are doing it in fasting. We are not taking our thyroid before testing for free T3, T4, TSH. Okay, so there's a basic concept which is, I think, I have cleared today, and very important. Okay, because thyroid is it's a metabolic hormone. It's a very major endocrine organ, and the levels of thyroid hormones are very delicate, and they show major physiological variations. So this is very important to follow. Something important for women especially. So women, many a times for infertility, their doctors, they tell you to do the hormone testing, right, for women. So note that the women's hormones, they fluctuate during the menstrual cycle, right? And these fluctuations, they can influence the results of your hormonal testing, right? So for this reason, when you're preparing yourself for the sex hormones testing, like आपको बोला है LH, FSH, ऐसे कुछ टेस्ट करने के लिए डॉक्टर ने बोला है, अगर आपको पीसीओडी है एंड दे वांट टू नो द लेवल्स ऑफ ऑल दिस हार्मोन्स, देन यू हैव टू आस्क देम प्रेफरेबली दैट मैं कौन से डे ऑफ साइकिल पे ये टेस्ट मुझे करना है. ओके, सो नॉर्मली व्हाट डॉक्टर्स टेल दैट LHFSH इस टेस्ट को आप साइकिल के सेकेंड या थर्ड डे पे कीजिए, या फिर कुछ अलग इंडिकेशंस हो सकते हैं कोई अलग कंडीशंस के मुताबिक, तो वो आपको डॉक्टर से जरूर पूछना है. Yeah, so and according to the doctor's recommendation, you see which day of the cycle you can test, and on that day only you have to take the testing, because hormonal testings are very sensitive and they fluctuate throughout the menstrual cycle of women. Okay, so that's an important point to note. Next is okay, some routine tests which do not require fasting, which can be done at any point of time, is liver function test, renal function test. So liver में पूरा आपका बिलिरुबिन और एंजाइम्स, लिवर एंजाइम्स आते हैं. रीनल फंक्शन टेस्ट मतलब किडनी के टेस्ट हैं, जिसमें हम ओवरऑल फंक्शन देखते हैं किडनी का. विटामिन टेस्टिंग यू कैन डू विदाउट फास्टिंग. ESR, CRP जो इन्फेक्शन के लिए टेस्ट होते हैं, आप उनको कभी भी कर सकते हो. CBC, कंप्लीट ब्लड काउंट, जिसमें आपका हीमोग्लोबिन, WBC काउंट, प्लेटलेट, ये सब दिखता है, वो आप कभी भी कर सकते हो. मलेरिया, डेंगू टेस्टिंग, ये भी आप कभी भी कर सकते हो. नो फास्टिंग इज रिक्वायर्ड. एंड ये जो सीरोलॉजिकल टेस्ट है जिसको हम लोग बोलते हैं, HIV, हेपेटाइटिस B, हेपेटाइटिस C, ये टेस्ट भी आप कभी भी कर सकते हो. ये बहुत कम रूटीन टेस्ट मैंने लिखे हैं, जस्ट टू गिव अ ग्लैंस, विच डू नॉट रिक्वायर फास्टिंग, और फॉर देम फास्टिंग इज नॉट कंपल्सरी. Now please note that for every test there are some alterations depending upon what you have eaten or what you have consumed, but for this test the alteration is minimum, so we don't do fasting compulsorily before this test. Okay. Yeah, so very important. Another area is how to give urine sample in the lab. Okay, so why? Because if you don't collect the sample properly, then your urine report is not accurate. गलती से आपको इन्फेक्शन दिखेगा या फिर जो है वो भी नहीं दिखेगा, and then the whole of your treatment goes wrong, right? So how to collect sample for urine routine testing? So first of all, जिस दिन आपको यूरिन रूटीन का टेस्ट करना है, उस दिन एक दिन पहले आपको लैब में जाना है. You have to collect the container for urine routine from the lab. Okay, do not use any container from your home to give the urine routine sample. So guys, this is a very important test. Do not underestimate this test. Do not take any container from home and give the urine sample in that. Go to a lab, take a sterile screw top container, right? And please write your name and date of testing on that container, right? So morning when you wake up, you have to give the first morning sample, preferably for urine routine, which is very good. First of all, wash your hands properly, right? Now, whenever you have to give urine sample, we always prefer a midstream sample. Midstream मतलब जो urine का middle part होता है, that is the very crucial thing for testing, right? So first you have to start to pee, discard the first part of urine, then start collecting the urine in the urine sample container, and then again you have to discard the last part of the urine, राइट क्यों? क्योंकि जो पहला पार्ट ऑफ यूरिन होता है उसमें बहुत सारे कमेंसल ऑर्गेनिजम्स, मतलब जो ऑर्गेनिजम्स नॉर्मल पार्ट है हमारे बॉडी के, वो आ जाते हैं, तो गलती से वो हम लोग इन्फेक्शन में देख सकते हैं, तो वो हमें नहीं पकड़ना है, इसलिए द फर्स्ट पार्ट इज टू बी डिस्कार्डेड. द लास्ट पार्ट आल्सो कैन बी कंटामिनेटेड विद सम कमेंसल ऑर्गेनिजम्स, सो इवन दैट वी विल डिस्कार्ड. We will need a clean catch midstream sample for urine routine. Okay, उसके बाद once you have collected the sample, shut the screw the lid of the container shut and wash your hands thoroughly. So this is how you will give the sample for urine routine. Okay, so how to store a urine sample, right? Now once like अगर ये जो urine sample आपने घर में collect किया है, that you have to make sure that it reaches the lab within 1 hour. Okay, now what will how you will you store it if you cannot hand it over to the lab in 1 hour? You have to put it in a sealed plastic bag and you have to store it in the fridge at around 4 degrees Celsius. And even in this situation, please do not keep it longer for more than 24 hours. Okay, why? Because if you're keeping it outside, the bacteria in the urine will multiply and your final report will come as urinary tract infection. Okay, so it's very important that you transport it within 1 hour to the lab. Okay, if you can't, please refrigerate at 4 degrees Celsius till you get it transported. Okay. Okay, what is the best time to collect the urine sample? The best time is the first early morning sample is the best sample, right? But urine routine में हम क्या करते हैं कि because it is one of the major emergency investigations, sometimes we accept the urine routine sample at any point of time. But preferably, if you want to check for infection, please go for the first early morning sample. Okay. So why? Because the level of bacteria and the chemicals in your urine in this particular sample is higher. Okay, so it's very easy for us to diagnose things. Okay. Yes. Now there are two types of urine tests that we normally do. One is a urine routine, जो हम infection के लिए check करते हैं. अगर यूरिन रूटीन में हमको इन्फेक्शन मिलता है तो हमको यूरिन कल्चर करना पड़ता है. तो कल्चर में हम क्या करते हैं कि जो इन्फेक्शन यूरिन रूटीन में हमने देखा है वो किस ऑर्गेनिज्म की वजह से है और उसको हम क्या एंटीबायोटिक दे सकते हैं. फॉर दैट वी डू यूरिन कल्चर. Correct? So urine culture, again, that's a more critical issue than urine routine. And for this, you have to ensure that you are giving in a sample under good aseptic precautions. Okay, so what you have to do, first of all, of course, wash your hands. Remove the sterile container from the packaging, write your name and label it. Please take it very seriously because good labs will never ever take an unlabeled sample. Okay, we do not accept any unlabeled samples in the lab. So please, whenever you're doing home collection, label all your containers properly. Okay, how females can do the instructions for this? You have to take a packaged moist towel, a sterile wipe, you can say. You have to clean the genital areas with that. You have to use 2 towels to clean the genital areas for females. And again for males also, you have to do the same. All the genital organs, they need to be cleaned thoroughly twice. Okay, with the sterile moist wipes or towels, whatever is available. Right. So once you have done that, females can start urinating and they have to again take a clean catch midstream sample without touching the skin. Okay, even females, even males, they can retract the foreskin with one hand and start urinating in the urine sample. Okay, this has to be sterile because we are giving the sample for culture, and for culture we are seeing the infection. So be sure that you're not introducing any unwanted infection while you're giving the sample. Okay. So don't fill urine to the top of the sterile container. Okay, you just have to fill up the container to half. No more than half of a container is necessary. Okay, so normally we have to have 10 to 12 ml of urine with us to do any type of investigation for urine. Okay, yeah, place the lid on the container once you are done with the urine sample collection, and set it on a sink or someplace till you finish urinating in the toilet, because the last part of the urine we are going to discard. We don't want that for any type of testing. Okay, then this was for urine testing. So we have covered everything. We covered the blood test, the fasting instructions, the diabetes testing, the cholesterol testing, the urine testing, and last but not the least, we will now see how to prepare yourself mentally for the testing. Now, this is very important. 70% of patients, they are absolutely okay. They have no issues in doing testing. 30% of patients still face many issues, which again is very much critical in getting the accurate results. Okay, so we'll just go through that. First of all, as I said, if you're doing testing tomorrow, please go one day prior to the lab, know all the instructions that are needed for doing the testing. Stay hydrated. Fasting is not dehydration. Please always remember. Stay calm. Okay, you don't have to have any type of anxiety while testing. If you're having anxiety, take deep short breaths. Okay, then communicate your concerns to the lab. What I mean by this is कुछ लोगों को ब्लड कलेक्शन के वक्त चक्कर आता है, या कुछ लोगों को वोमिटिंग होता है, कुछ लोगों को पूरा they collapse when they see the blood drawing from their veins. Okay, so if in past you had any experiences like that, you have to tell the lab prior so that they can prepare themselves accordingly. Right? So अगर आपको चक्कर आती है blood collection के वक्त, what we can do is, if we know beforehand that you face this problem, then we can take your collection in lying down position. Okay, so that you don't face this collapse during the testing. Okay, so communicate your concerns to the lab. If you want, bring someone with you whom you are comfortable with, who can give you some moral support. If you have anxiety seeing the blood being drawn, please don't look at the arm. Okay, that will increase your anxiety. Yes, especially in winters, it's not a problem in Mumbai, but then the colder areas, what happens is, if your body temperature is less, your veins collapse. And if your veins collapse, we can't get a smoother flow of blood from your veins. Okay, so keep yourself warmer every time, especially in winters. Okay, wear some sweaters if you are feeling very cold. Okay, and wear comfortable clothes. We have seen patients coming with the 3/4 sleeves or full sleeves, and then they are so tight that we can't even ऊपर भी नहीं कर सकते उसको blood collection करने के लिए. Okay, so every time wear comfortable clothes with loose sleeves when you come to a pathology lab for testing. Okay, so one thing is that for routine testing, okay, whatever, अगर आपको कोई भी problem नहीं है and you have to do a preventive health checkup for yourself, whatever test I have mentioned today in this presentation, all these tests you can do as a part of your routine health checkup. Okay, like you can do CBC, you can do liver function test, kidney function test, lipid, cholesterol testing, diabetes testing, and urine testing, and thyroid. Yes, so all these things, all these tests you have to include in your preventive health packages if you are absolutely healthy and you are just doing it as a part of your screening, right? Okay, so thank you for your attention. I am done with my part of presentation. So if you have any questions, we can take that now. You can already see some two in the chat box.
Thank you, Dr. Poorva. It's really amazing session.
Thank you, sir.
I'm not so good at this in part, but since I'm connected somewhere with health insurance industry, so I can understand this all test of purpose. But it's really eye opener, and the precautions which you're mentioning is really wonderful. And gratitude to you. And I request all those viewers who are watching this, repeat one more time. Go in our YouTube and see again the same video one more time. for you will get more insight, because sometimes
Yes.
your attention, but 2 or 3 times you will look at same video again. This particular session, I'm telling you, definitely you will get some benefit out of it. Thank you. So we have one more doctor here, Dr. Harsh. He's a diabetologist. Is very excellent
Okay.
person. Uh,
Okay. That's
Harsh,
great. Hello, doctor.
you can talk.
Yeah, yeah. Hello, hi.
Hi, doctor.
You're on mute. Dr. Harsh, you're on mute. You go on mute. Please, please.
Yeah. Am I audible now?
Yes,
Yeah, you're audible.
Yeah.
Yeah.
So very good afternoon, first of all. So Dr. Poorva, that was amazing session. You navigated so well, and this is something which is need of the hour. And in fact, Rohit bhai, I'll say you broadcasted 2 times, not once, because so many points were covered very aptly. So I'm a diabetes specialist and diabetes research scientist from BNI,
Okay.
from Hyderabad region, basically. So
Okay, great.
I represent a couple of other research front on diabetes. So excellent. Overall, it was very nice. I would like to congratulate you and keep doing this, not just to Mumbai, but entire India level. I'm sure this will help a lot of people. So just one point I wanted to add. Would it be fine if I add a point?
Yeah, please, sir. Yeah, sure.
So you mentioned about post-lunch, which is perfectly right. But as per global guidelines and the latest research evidences, post-breakfast is also necessary, though not that regularly done in India, but in major parts of in major parts of Europe, and particularly in South India, like in Hyderabad, Chennai, Bangalore, we do post-breakfast, not lunch. The reason being, the carbohydrate intake of a breakfast meal in South India is 3 times compared to what we see in Mumbai or the western part of the country, or even northern part of the country. Point number 2, when you do post breakfast, we have to advise patients for 90 minutes, not 2 hours. Why? Because the pancreatic response till 11 a.m. due to the hormonal response is such that in the breakfast sample, if you maintain 90 hours, you're likely to get a more accurate sample. But this has to be educated to the patient, because we as doctors and clinicians know it, but common people should be educated on this front. So that's one thing.
You rightly said. In South India, of course, the carbohydrate content of breakfast is much, because they eat more of rice there.
Absolutely.
So geographically also this may vary.
Absolutely. So other practice, what we do in our center is we have compulsory mandated test called C-peptide. I know it's an advanced test, but then we do for every patient, because we are a dedicated diabetes advanced center. So why this is very important is because there are many people who come to you who are on insulin. So that's where this is mandatory, because I have got series of cases where we have dropped insulin because their C-peptide levels are excellent. So then we have some advanced treatments where even without insulin we can control the sugars. But we also have opposite situations जहाँ पे 10-12 गोली चल रहा होता है पेशेंट का शुगर में, but body insulin बिल्कुल भी बना ही नहीं रहा है. अभी और 10 गोली ऐड किए तो भी शुगर कंट्रोल नहीं होने वाला उसका, because body has stopped making insulin and that person needs insulin. तो ये जो टेस्ट है बेसिकली दूध का दूध पानी का पानी कर देता है. So if your center can offer that provision for people on insulin, I'll strongly recommend कि ये टेस्ट तो कंपलसरी करना ही चाहिए. It is very simple. So and we follow a protocol which is again 90 minutes after breakfast of C-peptide, because 11 बजे के बाद C-peptide का level का भी वो readings थोड़ा it starts to change.
C-peptide specifically 90 minutes we do.
तो ये आप add कर सकते हो for people who are on insulin.
Surely.
Just a couple of points thought to add, but otherwise
Thank
it
you,
was
sir.
extraordinary. It was very extraordinary, and congratulations again. And Rohit bhai, amazing session. Keep doing such great work. Yeah.
Thank you. RB Group is made only for helping our entrepreneurs and Indian people to bring awareness and wealth both together. So thanks for joining us and thanks for adding these points. And again, special thanks to Poorva. Anyone has a query can raise your hand or can tell me so I can unmute and you can speak. Yes, Mr. Dheeraj.
Hi, Dr. Poorva. Nice talking to you. Nice session. I was
Hello.
listening very carefully because hello, Dr. Harsh as well. So you are a diabetologist, and I have a diabetic patient since last more than 25 years. And I've been maintaining my blood sugar levels on the medication that I have been advised by the diabetologists like you. Now, my question was, Dr. Poorva, you are in Dombivli area in Mumbai, right?
Yeah.
Do you have home collection? Do you have home collections facilities available?
Yes, sir. We have home collection facilities.
Because I'm in Nerul, so I mean, if I have to utilize your services, I cannot come to Dombivli, to be very honest. Especially 2-3 times, it's difficult, to be honest. I mean, so I just want to know if you have home collections also.
Yes, sir. We have home collection services.
Fine, we'll be in touch. And second question is very actually little different, little awkward actually. I'm sorry, I'm raising this query actually because I have faced this experience in the past. And this is related to the something which is not ethical, I would say. I'm sharing this for the benefit of everybody who's attending this session out here. You know, I had gone one of the very famous labs had come to our society for doing these tests, and they came with a package. 1500 रुपए में इतने test कर देंगे and all that stuff. So both of us, me and my wife, you know, we registered for them, and we got the test report. And the test reports came the next day or two after later. You know, you'll be shocked. The results of both the patients, me and my wife, were exactly the same as if it was double printed, 2 prints of the same, only the name and age and sex was changed. Absolutely same figures. I went to them and said, what the hell is this? Do you charge for printing the reports, or do you actually test the samples? They took the samples, but the reports were, believe you me, I'm not saying, I'm not lying, I'm not joking, exactly the same. My name, Dheeraj Malhotra, M56, Sunita Malhotra, F54, and the rest of the result is exactly the same. Now, how to avoid this? My question to you is this. How do I avoid such labs? How do I identify such labs? How do I identify such practices? I'm really sorry to raise this question, but I was tempted to ask you, since you are all of business entrepreneurs and we know each other very well. So that's why I have this courage to ask you this question. Excuse me if I'm saying something wrong.
No, that's okay.
Thank you
sir.
so much.
This is regarding our health, and everybody's health is precious, right? So if we have any concerns regarding the health issues, then we have to raise them. Sir, actually, we all know that there are many unethical things going on in healthcare, and they are going on in pathology also.
Correct.
There are many technician-run labs, right? There are many corporate labs who have many pathologists on board. And maybe I haven't seen them actually functioning, but whenever, sir, we do any test in lab, there is a cost associated with that test, right? And what is that cost actually? That cost is of the quality controls that we run on our machines, right? Because without the quality controls, though, we cannot run the sample. A lab shouldn't run the sample. Okay, ideally, what is according to the guidelines of NABL? So the quality controls have to be run. The machine should be under excellent maintenance, right? The lab has to pay for the AMCs and CMCs of the machines, and they have to do it regularly. So that is one cost. So all this cost, jo milke, any lab cannot give more concession on any test. Right? So if anybody is telling कि मैं आपको 100 रुपए में ये सब टेस्ट करके दूंगा, मैं आपको 500 में ये सब टेस्ट करके दूंगा, the more possibility is that we are not doing the test.
Correct, because there's a cost involved. I am myself a chemical technologist, so I know how the tests are done and how these costly are. So that means wherever these freebies are available, most probably they are the unethical labs. Yes. So this is what the point was. Yes.
Avoid people who are giving you free services, because any service which is good, it has some amount of finance associated with that. And I think avoid that people who give you free tests. That's
any other input other than the cost, which can lead us to identify an unethical happening.
Yes, sir. I think the best thing is because if you ask them कि आपके पास कोई pathologist है क्या, वो हाँ ही बोलेंगे. So see, in-house pathologist is very important, sir. In-house pathologist in a lab will supervise the machines, will supervise the quality controls, will supervise the samples that are running in the lab. For that, pathologist has to be present in the lab. Okay. Unfortunately, there are many labs running which don't have an in-house pathologist, and that's a real poor state of affairs. But you can go to the lab, insist on meeting the pathologist, insist on giving you a comment on your reports. Yeah, go to the lab, talk to the pathologist. This is my report. What do you think of it? So whenever you will start asking for a pathologist, asking for a meeting with the pathologist and talking with the pathologist, they will know that what is the requirement. The people are also very, they know everything nowadays. And if they are paying you even 60 rupees, that should be worth it.
Correct.
Yeah, so that you can do, sir. You can visit a lab where there is a pathologist. You can see with your eyes that they are present in the lab and they are supervising your sample.
All
That's
right.
the only
Okay.
way
Yeah.
out.
Yeah. Thank you so much. Thank you.
Thank you.
Difficult to find, not only in health industry, or any industry.
In any industry. Yeah.
So
I can see a question here.
Yeah.
Is it necessary to have a doctor's prescription?
When they are going for total body analysis, you mean to say
as per legal provisions? Okay. So actually, no any legal provision is there which tells you that if you have to do a total body checkup, you need a prescription. You can do any health checkup for your screening purpose if you're absolutely healthy. Of course, if you have to do any specific test, जैसे कि that only doctor can prescribe depending upon your health. For that, you will need the prescription. But otherwise, if you're doing it for just a routine screening, you will not need any prescription for that.
Silky want to ask something. Silky, are you there? Silky Kapoor.
Okay.
Yeah, you can.
Yeah, she's raising that. Yeah.
Yes, good afternoon, everyone, and thank you, ma'am. It was very informative. Especially the post breakfast and post lunch test was there was a clarity which there was a misconception, and thank you for that. One question, I don't know whether I should ask it or not. I just wanted to understand the difference between TSH and FSH, free wala thyroid and the total. So when to do, what to do, means when how to decide which is good for me if I don't want to ask a doctor.
Yes. So basically, the thyroid hormones, जो हमारे blood में रहते हैं, they are present in two states. Okay, one is a total hormone which is bind to a specific protein, and other is a free hormone which is not bound to any specific protein. Now, basically, you need a total T3, T4, TSH or a free TFT. Well, is actually a call of your doctor. Okay, depending upon आपका thyroid condition क्या है, what is your disease of thyroid, that will be decided by your doctor. You just have to be mindful that you know that these two types of TFT exist. You have to clearly ask them that मुझे कौन सा test करना है, and then accordingly you can do the instructions, because as you we saw in the PPT, the instructions for both type of tests are very different.
Yes.
Yeah, very different. One is requiring fasting, one is not requiring fasting. एक में आप medication ले सकते हो, दूसरे में आपको नहीं लेना है. तो इतना important है ये जानना. Okay, so anytime let your doctor decide that what type of test you need, and you just be careful to ask, to remind them to tell you that yes, you have to do this and you have to total करना है कि free करना है. Let them decide and you go accordingly.
No, I am a patient of thyroid since last 15 years.
Okay, so you are taking thyroid regularly?
Yes.
अच्छा,
so,
okay.
अभी every time तो वो डॉक्टर से क्या पूछना normally?
अच्छा, so then you have to do free, ma'am. Free T3, T4, TSH. So if you're already on thyronorm tablet, most probably you will be needing the free levels of hormones. But once you can ask your doctor so that you know every time that if I am a thyroid patient, I have to do free T3, T4 only.
Okay.
In my opinion, it has to be free TFT.
Yeah. Thank you so much, ma'am. Thank you, and you are wonderful, ma'am.
Thank you so much. Thank you.
Yes, Dr. Harsh.
Yeah, so those were some amazing addresses. So one information I'd like to share to all is, friends, as Dr. Poorva was saying, there are multiple laboratories with multiple branches, and many times what they do is they do false printing of certifications. So don't get cheated by going to a lab just with the certification. The reason is the main branch of that XYZ chain may hold all the certifications, but the branches do not.
Yes.
So where the processing happens, there's no way to know unless you call the head office or health center or something. So that's a very, very important thing, because we see many patients getting cheated in the name of all these certifications. And how Mr. Dheeraj pointed out, there have been instances like this even in other metros, not just in Mumbai. So that's a very important thing, because certification, yes, they do mention on quality of processing and all, but that doesn't necessarily mean that all branches of that chain have the same certification or the same protocol. So be very, very careful on this aspect. So that's just one point which I wanted.
There needs to be more awareness on these things actually, for the patient side, more of it. So I hope the things improve in future.
Let's move to Mr. Bobby Nair.
Thank you, Rohit sir. Very good evening, ma'am, and it was a wonderful session. I really appreciate that for all the information given. With your permission, actually, it was a request directed to Dr. Harsh. Dr. Sir, will it be possible for you to share your email ID? I would want to, communicate with you regarding my father. Is it possible?
He's there in group only, Bobby sir. You just search in our app, Dr. Harsh.
Oh, definitely. I'll search and I will come back to you, sir. Thank you so much. I really appreciate that.
Yeah. So, any other queries? Any other query, or shall we close the session? Dear all, I have shared a link in the chat box, which is the link, the flyer which is shared on our LinkedIn page. If you can click on this and can give your feedback about today's session, it will be a great motivation to Dr. Poorva, and it will be good, to show gratitude in return to someone. So if you find the session useful, please click on this link which is given in chat box, and please share your feedback and appreciation. And yes, Dr. Poorva's number, ma'am, you can share your number if you are comfortable in the chat box. So if someone interested can contact you later as well. Okay, so I'm closing the session, and thank you again, Dr. Poorva, and all the participants who joined this session today. And I will again, remind you to watch the same session again one more time, so you will get more ideas, and definitely